Genius Solutions: How to Meet Advancing Care Information Measures for MIPS. This video will go over the following topics: important information about the Advancing Care Information category, all of the measures including the base, the performance, and the bonus measures, then demonstrate how to meet each one of those measures in ehrTHOMAS, then lastly go over helpful resources. The Advancing Care Information is a category associated with the Merit-based Incentive Payment System, or MIPS. It is one part of four. This category replaces what used to be meaningful use for the Medicare EHR Incentive Program. If you are unsure if this information is applicable to you, please check out our Medicare Merit-based Incentive Payment System video. The Advancing Care Information will make up 25% of your composite MIPS score. All the measures that you will see here are similar to the measures you've seen in meaningful use. In fact, if you used ehrTHOMAS for meaningful use, then you already know how to meet most, if not all, of the new Advancing Care Information measures. The clinical decision support and the computerized provider order entry measures are no longer required for this new category. The scoring is based on your performance, or how much data you put in for that measure. Thresholds do not exist to meet the Advancing Care Information category. However, there are required measures that you will need to perform before you can apply the performance measure to your score. You can choose which additional measures you want to use to improve your score. Additionally, you do not need to report quality measures twice. Quality measures only need to be reported through the quality category. It is important to note that eligible clinicians must earn the full base score in order to earn any score in the Advancing Care Information Performance category. In addition to the base score, eligible clinicians have the opportunity to earn additional credit through the performance score and the bonus score. There are two options based on your EHR edition of what type of data you can submit. Advancing Care Information Objectives and Measures uses the 2015 EHR edition, while the 2017 Advancing Care Information Transition Objective and Measures uses the 2014 edition. ehrTHOMAS is certified for the 2014 edition. The rest of the Advancing Care Information will focus on the 2017 Advancing Care Information Transition Objectives and Measures. There are three categories for the Advancing Care Information. There are based or required measures, performance measures, and bonus measures. All eligible clinicians must meet the required measures before the additional performance measures can be utilized. We will be touching base on each one of these measures and how to perform each measure using ehrTHOMAS. So let's go over the base measures. Protect electronic health information. Measure. Conduct or review a security risk analysis in accordance with the requirements in 45 CFR 164.308, Parent A, Parent 1, including addressing the security, to include encryption, of the electronic patient health information data created or maintained by the certified EHR technology in accordance with the requirements in 45 CFR 164.312, Parent A, Parent 2, Parent 4, and 45 CFR 164.306, Parent D, Parent 3, and implement security updates as necessary and correct identified security deficiencies as a part of the MIPS eligible clinicians' risk management process. CMS requires all eligible participants to conduct a security risk analysis. Please refer to the Security Risk Analysis tip sheet on the CMS website for more detailed information about this measure. If the office has their own hardware technician, please contact them regarding security risk analysis. There are also some great websites like healthit.gov that will provide free tools to assist providers in completing this measure. Prescribing. Measure. At least one permissible prescription written by the MIPS eligible clinician is queried for a drug formulary and transmitted electronically using certified EHR technology. To prescribe a medication, click on the Medications module. Then click on Doctor First. You will be redirected to the Doctor First webpage. If this is your first time entering a prescription for your patient, you will be prompted to add in the patient's pharmacy and allergy information. Once you've completed this, click the Prescribe button. Type in the appropriate prescription name, and then click on Find. Select a medication from the generated list. Do not free text a medication. Enter in the appropriate drug information, and then click on Continue. Review the prescription on the next screen, and if everything is correct, click OK. Make sure the prescription you want to send is selected, and then type in the signature password. Then click on Send to send your prescription. Click on Return to EMR when complete. Patient electronic access. Measure. At least one patient seen by the MIPS eligible clinician during the performance period is provided timely access to view online, download, and transmit to a third party their health information, subject to the MIPS eligible clinician's discretion to withhold certain information. To provide the patient with the ability to view, download, or transmit their health information online, in an open encounter, click on the patient's name or picture to open the patient edit screen. Scroll down to the bottom and click the drop-down for Health Vault. Then click on the Connect to Health Vault button. Fill out the security question and answer and make sure the patient knows what the security answer is, as it's required for registration. Enter in the patient's email address if the Send email area isn't filled out. Then click on Send. The Microsoft Health Vault instructions will appear, and you can print out the instructions on how to set up their Health Vault account by clicking on Print. The patient will also get instructions sent to their email. Once the invitation to register for Health Vault has been sent, information regarding the registration will show up. It will show the expiration date of the registration, the last time the EHR has checked to see if the patient has signed up with Health Vault, the ID code, which is a security feature for Health Vault, the patient's name, the security question, the security answer, and the current status of the patient's registration. To check if the patient has created a Health Vault account that is associated with your office, click on the Check for Complete button. If the patient has not completed the registration process, the screen will not change. It is important that the user reissues the Health Vault access at every visit if the patient has not completed the registration. If the patient has completed the registration, clicking on Check for Complete will show the date of when the patient was registered for Health Vault, the date of the last CCDA created for the patient, and the status changed from pending to complete. Now, when you create a CCDA, you will have the ability to send the CCDA via Health Vault. You must send the CCDA to Health Vault if the Health Vault registration has been completed. To do this, click on the Create CCDA button, and then click Send to Health Vault. A pop-up will appear notifying you that the CCDA was sent to Health Vault and asking you whether or not you want to view the CCDA. Go ahead and click on No. By default, the system will automatically create a CCDA when the note has been signed. When you see the CCDA created screen, the Send to Health Vault button will be illuminated, and you can directly send the CCDA that was created to the patient's Health Vault account. Health Information Exchange. Measure. The MIPS eligible clinician that transitions or refers their patient to another setting of care or healthcare clinician, 1. Uses certified EHR technology to create a summary of care record, and 2. Electronically transmits such summary to a receiving healthcare clinician for at least one transition of care or referral. If the provider is transitioning a patient to another setting of care, the office must indicate that the patient has transitioned out of the office. To indicate that the patient has transitioned, click the Change Encounter Header Information button. Select the appropriate transition status from the drop-down menu, and then click the Transition Out checkbox. Then click Save. A clinical care document now must be created. Click on the Create CCDA button, and then either click Create CCDA or Print CCDA. Once a CCDA has been created, a screen will appear to indicate so. The second portion of this measure is to send a summary of care to the provider that you're transitioning the patient to via ehrTHOMAS or through a health information exchange program. ehrTHOMAS can send direct messages to other providers as long as the other provider's EHR is associated with the Blue Button Plus community group or a direct trust group. Your office will need to obtain the other provider's direct address. Once you have that address, you must record that information inside of ehrTHOMAS. To do this, click on Code Files, then click on Referrals. Select the appropriate provider, and then click on Edit. Enter in the provider's direct address into the direct address input area. Then click on Save. Once you have the direct address for your other provider, you can now click on the Send Direct button. The Send Direct message screen will appear. The provider will already be filled out for you. Start typing in who you want to send the clinical care document to, and click on his or her name. The patient and the encounter will already be selected, so type in a subject and a message. Once you're done filling out the subject and the message, you can click on Send to send that message to the other provider. If the provider you want to send a CCDA to is not associated with the Blue Button Plus community group or the Direct Trust community group, you must indicate that the CCDA was sent through HIE or through a secure transmission by clicking either the Sent to HIE or Sent to Secure Transmission checkbox. You will need to indicate which provider you're sending it to by clicking on the magnifying glass and selecting your provider. It is important that you send the CCDA on the date declared in the Sent On input area. The Send Secure Transmission checkbox works the same way as the Send to HIE checkbox. Once you have indicated in your EHR that you are sending the CCDA through an HIE or a secure transmission, you must go to your HIE and send the message to that provider, or send your CCDA through that secure transmission. For more additional help regarding this measure, please call Genius Solutions EHR support. Performance measures. View, download, or transmit. Measure. At least one patient seen by the MIPS eligible clinician during the performance period, or patient authorized representative, views, downloads, or transmits their health information to a third party during the performance period. It is best practice to walk through the registration process with the patient to ensure they have registered with the Health Vault, a CCDA was sent to the patient's account, and the patient has reviewed their health information. To view which patient has viewed, download, or transmit their health information, go to Reports, and then click on VDT Report. Enter in the start date and the end date of your reporting period. You can click on Search Health Vault to pull direct patient data from the Health Vault servers, or click on Search Your Data to pull information from your system. For additional help setting up a Health Vault account, please see our video on ehrTHOMAS and Health Vault, or contact Genius Solutions EHR support. Patient-specific education. Measure. The MIPS eligible clinician must use clinically relevant information from the certified EHR technology to identify patient-specific education resources and provide access to those materials to at least one unique patient seen by the MIPS eligible clinician.
There are 3 ways to meet this measure: by printing out preloaded educational documents, indicating that verbal education was provided, and/or clicking the Medline Plus icon. To print out educational documents, click on the Education module. Click on the appropriate preloaded document, and then click Next. Select Open File to print out the document and hand it to the patient, followed by Complete when you're done. Click Save to save your results. To indicate that verbal education was provided, again, click the Education module and select Add Free Text Education. Type in your caption and the type of verbal education that was provided, and click Save. Click Next, followed by Complete, and then Save to save your results. To use the Medline Plus icon, you can find it in the Medications module and the Condition Tracking module. You will find the icon next to the prescribed medication and next to the diagnosed condition. Clicking the Medline Plus icon will redirect you to a web page containing information on the diagnosis or medications related to the particular patient. For example, clicking in the medications icon, followed by the Get Medline Plus Connection info, redirects you to the following website. Here you will find the information on the medication or diagnosis related to the particular patient. You may print out the document and hand it to the patient.
Secure messaging. Measure. For at least one patient seen by the MIPS eligible clinician during the performance period, a secure message was sent using the electronic messaging function of the certified EHR technology to the patient or the patient authorized representative, or in response to a secure message sent by the patient or the patient authorized representative during the performance period. Before you can send a message to a patient, the patient's direct address must be obtained and entered into the appropriate field inside of ehrTHOMAS. The patient's direct address can be found on the main page of the patient's Health Vault account under Health Messages. Once you have obtained the patient's direct address, you will need to go into their chart and click on the patient's name or their picture. Click on Other Demographics, and scroll down to find direct address. Enter in the direct address here. Then click on Save. Now you can send the message to the patient. Click on the Message button, and then click on Direct Messages. If you do not see the Direct Message tab, please contact Genius Solution Support. From here, click the Add button. Select the appropriate provider in the dropdown, and start typing in the patient's name. Then click the patient. If you do not see your patient in the dropdown, you do not have their direct address filled out in his or her demographics. Then fill out the subject and message. Once your message has been filled out, click on Send. If you have received a message from your patient, click on the message, and then click on View. You will see that a patient is not associated with this message. Add the direct address to the patient by clicking on the Attach to Patient button. Search for your patient, and then click on Select. To reply to this message, click on the Reply button, and then fill out the form appropriately. Once the form has been filled out, click on Send. Medication reconciliation. Measure. The MIPS-eligible clinician performs medication reconciliation for at least one transition of care in which the patient is transitioned into the care of the MIPS-eligible clinician.
This must be done for every patient that is transferred into the office. There are 2 steps in meeting this measure: indicating that the patient is a transition into the office and filling out the medication module. To indicate that the patient is a transition into the office, create or open a new encounter. If the current encounter screen does not appear, you may click the Change Encounter Header Info button. Change the transition status appropriately from the drop-down menu, and make sure the Transition Out box is not checked off. Click Save to save your results.
Now you must perform medication reconciliation for the patient. This must be done through the medication module, following the same steps as the e-prescribing measure. Immunization Registry Reporting. Measure. The MIPS-eligible clinician is in active engagement with a public health agency to submit immunization data.
ehrTHOMAS has the ability to export HL7 files for immunizations in the states of Michigan and Florida. If your practice performs any immunizations, the setup to send electronic data has already been completed. There are 2 ways to send electronic data to immunization registries: by individual vaccinations or by batch. To send HL7 files by individual vaccinations, in an open encounter, click on the Immunizations module. Then click on the drop-down arrow next to a Perform Vaccination on the left side of the screen under Vaccination Received. Click Create HL7. To send HL7 files by batch, click on the Reports button, and then click on Immunization. Complete the appropriate fields, and then click the Export button.
And lastly, bonus measures. Syndromic surveillance reporting. Measure. The MIPS eligible clinician is in active engagement with a public health agency to submit syndromic surveillance data.
To produce the syndromic surveillance report, click on Reports, followed by Syndromic Surveillance. Select the appropriate timeline and the appropriate doctor, and then click the Export button.
Specialized registry reporting. Measure. The MIPS eligible clinician is in active engagement to submit data to a specialized registry. If you are associated with a specialized registry, please contact Genius Solutions EHR support regarding submitting data. Please review the following websites for additional help: the Quality Payment Program website for information regarding the MIPS program, Centers for Medicare and Medicaid Services for the latest industry news, Genius Solutions website for product information services, and the Genius Solutions YouTube page for educational videos about our software products. This concludes our How to Meet Advancing Care Information Measure video. If you have any additional questions, feel free to give our support team a call at 586-751-9080, Monday through Friday from 8 a.m. to 6 p.m. Eastern Standard Time. Thank you for watching.